Hello, my name is Dr. Dewan S. Raja. Today I will solve some multiple choice questions in head and neck from Norma Lateralis. This is the lateral aspect of the skull. Let's start solving the questions. Question number 1. An 8-year-old boy has developed mastoiditis. His ENT surgeon suggested removing pus from the mastoid antrum. Which of the following is the best route to reach the mastoid antrum? Choices are suprameatal triangle, occipital triangle, nasopharynx, temporal fossa, infratemporal fossa. So how the surgeon will go to the mastoid antrum to remove the pus? Which is the best route out of this? Answer should be suprameatal triangle, that is located just posterior superior to the external auditory meatus. So answer is A. Question number 2. Which of the following structures forms the roof of the infratemporal fossa? Lateral pterygoid plate, medial pterygoid plate, ramus of the mandible, greater wing of the sphenoid bone. What is the answer? Answer is the greater wing of the sphenoid bone that forms the roof of the infratemporal fossa, the greater wing of the sphenoid bone. Question number 3. All of the following muscles are inserted on the outer surface of the mastoid process except one. The exception is what? Splenius capitis, longissimus capitis, trapezius, sternocleidomastoid, which does not insert to the outer surface of the mastoid process of the temporal bone. Answer should be what? Trapezius. C is the answer. Trapezius. Question number 4. The gap between the zygomatic arch and the side of the skull transmits which of the following structure? Masseter muscle, temporalis tendon, medial pterygoid, lateral pterygoid muscle. Which one? Passes between the side of the skull and the zygomatic arch. Which structure passes through this passage? Answer should be temporalis tendon. This muscle takes origin from the temporal fossa and temporal fascia, inserts to the coronoid process of the mandible. So we got that. Question number 5. A 30-year-old batsman receives a strike from a cricket ball while playing the delivery of a fast bowler. The batsman became unconscious, instantly regained consciousness after a short interval, and then passed away in a deepening coma. An X-ray revealed fracture in the pterion area. All of the following sutures are united at the pterion area except one. The exception is what? Coronal suture, sphenoparietal suture, spheno-squamous suture, lambdoid suture, squamous suture, which does not come to form the pterion area. Okay, answer should be the lambdoid suture. Okay, so this is space around the sphenoparietal suture area. Okay, including coronary suture, spheno-squamous suture, squamous suture. Okay, but not the lambdoid suture. Lambdoid suture end up in the asterion area. Okay, So answer should be the lambdoid suture. It is the exception. It is very important presentation of epidural hemorrhage, extracranial hemorrhage. What happened? The pterion area, underneath it we have the meningeal vein, anterior stem of the middle meningeal artery, the middle meningeal vein, anterior stem of the middle meningeal artery, okay, are located, and also the stem of the Sylvian sulcus, lateral sulcus is located underneath the pterion area. So any injury there may be hemorrhage due to destruction of the blood vessel, especially the middle meningeal artery, and that may lead to epidural hemorrhage. Okay, and this is the typical presentation to many patients, not necessarily to everyone. And we must know the pterion, importance of pterion, what structure is underneath the pterion, what suture are coming close at the pterion area. Okay, we got that. Now we'll go to this area. All of the following sutures meet at the asterion except one. Okay, what is that exception? Petrotympanic suture, occipitomastoid suture, sphenoparietal suture, lambdoid suture. Which does not meet at the asterion? Answer should be sphenoparietal suture. Around the sphenoparietal suture we have the pterion. Okay, so asterion doesn't include the sphenoparietal suture. Okay, this is asterion. That is the posterolateral fontanelle in the newborn baby, usually closes by 2 months. Okay, and all other suture come in close together except the sphenoparietal suture. So answer should be C, sphenoparietal suture. Question number 7. Which one of the following structure forms the lateral wall of the infratemporal fossa? Lateral wall of the infratemporal fossa. What structure is forming the lateral wall of the infratemporal fossa? Choice 1. A. Greater wing of the sphenoid bone. B. Squamous part of the temporal bone. C. Lateral pterygoid plate. D. Pyramidal process of the palatine bone. E. Ramus of the mandible. Lateral wall. What is the structure? The ramus of the mandible that forms the lateral wall of the infratemporal fossa. Number 8. Which of the following structure is transmitted through the tympanomastoid fissure located on the anterior aspect of the mastoid process? What structure is transmitted through tympanomastoid fissure? A. Auricular branch of vagus nerve. B. Meningeal branch of the occipital artery. C. Zygomaticotemporal nerve. D. Chordae tympani nerve. What is the answer? For this structure, for this fissure, tympanomastoid fissure, what structure passes through this fissure? Tympanomastoid fissure. Answer should be auricular branch of the vagus nerve. A is the answer. Auricular branch of the vagus nerve. Okay. Number 9. Which of the following structure passes from the intracranial cavity to the infratemporal fossa through the petrotympanic fissure? So, from the intracranial cavity to the infratemporal fossa through the petrotympanic fissure. So, what structure is transmitted through the petrotympanic fissure? Facial nerve, chordae tympani nerve, glossopharyngeal nerve, auricular branch of the vagus nerve. Answer should be what? Answer should be the chordae tympani nerve that is transmitted through the petrotympanic fissure. Chordae tympani nerve pick up sensation from the anterior 2/3 of the tongue except the velar papilla. Okay, this is a branch of facial nerve, but it passes through the petrotympanic fissure. Facial nerve like to come out through the stylomastoid foramen. Okay, so answer should be caudate tympanic nerve for this fissure. Okay. Question number 10. The mastoid foramen transmits an emissary vein connecting the posterior auricular vein with the what? With the sigmoid vein, sigmoid sinus, transverse sinus, straight sinus, confluence of sinuses, inferior sagittal sinus. Answer is what? The mastoid foramen transmits an emissary vein connecting the posterior auricular vein with the what structure? With the sigmoid sinus. Answer is A. Answer is A. Okay, these are the answer keys what we discuss. Okay, we got that, and that's all about the MCQs in head and neck from Norma Lateralis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice and blessed day. Bye now.